Welcome, I am Etienne Hirsch. Today is Sunday, June 13, 2010, and I am interviewing Professor Agid. He is a recipient of the Marsden Award lecture here at the Buenos Aires 14th meeting of the Movement Disorders Society. Professor Agid, welcome. I would like to start this interview by asking you about your training, your early years, and how did you become interested in neuroscience and in neurology?
Well, I've had an atypical training because doing both research and medical studies is usually uncommon in our country, in France. In fact, the reason is probably because my mother, who is of Swedish origin, she's Swedish in fact, was an artist, which probably gave me some fantasy. And on the other hand, my father was a medical doctor. He was also a researcher, a scientist, in the field of endocrinology. So with him, I learned curiosity, and I understood that rigor was something very important if you were doing research. So this is why I did both. I had a training both in medicine and in science. As a medical doctor, this was done at the Salpêtrière Hospital, where I had my medical training, a residency. And I decided to do neurology because I was interested in mental functions at that time. Problem with memory. I was fascinated by the problem, the origin of memory. Why are we thinking? How the brain, which is a organic structure, can produce thought, which is immaterial. And in fact, initially I wanted to become a psychiatrist, but I thought that it was too complicated to study mental function without lesions in the brain. So this is why I decided to be involved in neurology. And then I had the second problem. At the time I wanted to be a neurosurgeon, but I knew that if you are a neurosurgeon, then it's time-consuming, and you wouldn't be able to do research. This is why I studied neurology. And with during all these years, until the age of 31, in fact, I started research training only when I was 31 years old. And the reason is that in our country we don't have MD, PhD programs. So I lost a lot of time in the field of research. And I remember when I came in the middle of my residency program, I decided to do research. I became an assistant in teaching biochemistry. I was involved in biochemistry, but I lost a lot of time because at that time research, there was no research at the Salpêtrière Hospital. Neurologists were mostly clinicians, and none of them was doing science. So, but after years and years of effort, and late during my career, I became a professor of neurology on one hand, and a professor of cell biology on the other hand. So finally I was able to do both, to become both a clinician and a researcher. But it took an enormous amount of time and efforts.
So you are, in one way, a pioneer in this type of MD, PhD programs in France. And what are your thoughts for the future in this double career? So do you think that young students should continue that way? Or?
You see, when I was starting my PhD program in Jacques Glovinsky's lab at the Collège de France in Paris, I had the opportunity to give a talk at the NIH in Julius Axelrod's lab. And there I met Tom Chase, And I was fascinated because he was doing exactly what I had in mind, in fact. That is, on one, there was a big corridor, and on one side of the corridor were the patients, hospitalized patients. And on the other side of the corridor, lab spaces. And Tom Chase and his teams was passing from the lab from the bench to the bed, as we say, and back every hour. So this is what he was the model I, in fact, had in mind when I came back from the States. So he was one of the pioneers. And in particular in Europe, in particular in France perhaps, this idea to be both a clinician and a researcher was really uncommon, which is less so at the present time. In my time, clinicians were taking care of patients, that's all. Science was done by the scientists. But today, we still have the same problem. I mean, many young neurologists want to do research. They try to do research, but instead of going back and to spend 4 years in the lab in order to become a PhD, they are doing clinical research, testing drugs, or doing retrospective studies in patients, which I think is very descriptive and useless.
You mentioned a few names of people who were really influential in the field. Do you have other heroes in the field, and who were your mentor, who were influential in your career?
Unfortunately, when I was young, when I was really young, I had no name in mind. I was interested in philosophy. I was reading René Descartes, for instance. But I have no idea of a scientist. Einstein was too complicated. I knew Darwin by name, Claude Bernard by name, but I never read these authors, what I've done afterwards. In fact, quite recently. Otherwise, I would have been much more clever, I think, than I was at that time. So, as I said, I had the opportunity to have two mentors in the Department of Neurology at the Salpêtrière Hospital. These were very powerful people at that time, François L'Hermite and Paul Castaigne. They seemed not to be interested in science. In fact, they were. And they were interested in what I did, because I was a clinician, a so-called chef de clinique, a sort of register on one hand, but in the same time I had the training in Jacques Glowinski's lab. That's a very interesting story. During my residency, I was looking for a lab where I could do exactly what I wanted. I was not able to find such lab. I mean, it was archaic. It was not really robust science, at least from what I knew at that time. By chance, I had the opportunity to meet Dr. Glowinski, Jacques Glowinski, who was one of the students of Julius Axelrod coming back from the States. He was the man of the neurotransmitters, and in particular studying the metabolism of catecholamines, and with a special reference to dopamine. And I met this guy. I was fascinated because it was exactly what I had in mind. Not dopamine, that I didn't care for dopamine, but I was interested in the way he was thinking. And in fact, we became very good friends, and I spent almost 5 years in his lab. And so that I had indeed the opportunity to have a double training. My training is much better in the clinical field, but in science, spending 5 years in the lab gives you some idea of what science can be. One, science is deterministic, which is not the case of medicine, when the attitude, when the philosophy finalism. You have to take care of patient. There is an aim. You have to. You can't stop saying one. You cannot open the belly of someone and saying, well, it's too difficult. I will come tomorrow to see what happened, which is possible in science. In science, you have to get this deterministic attitude with a lot of rigor, hypothesis, and so on. And it's difficult to become a good scientist, I'm sure. So just spending 1 year in the lab is not enough. But so influential, yes. Jacques Lovinsky and my mentor in the clinical field. And then I had the opportunity to meet two important people in the field of movement disorders. The reason is simply I was studying the metabolism of dopamine in the lab, doing biochemistry and cell biology. And of course, there was a relationship with Parkinson's disease. And when I was at the Collège de France doing my PhD, one of the postdocs came, and this postdoc was Stanley Fan. And Stan Fan and I became very close friends. He wanted to learn biochemistry. He was already, he's elder than I am. He was already an excellent clinician, but also he had some knowledge in the field of science. Once I remember, I took him at the Salpêtrière Hospital in order to show him a patient that I didn't understand what this patient had. In fact, this patient had a dystonia, but I didn't know what was dystonia. So he looked at the patient. This is dystonia. Ah, okay. So this is the start of my specialization in the field of movement disorder, because at start I was a neuropsychologist. I was interested in the problem of strategy of action, memory problem, language, and so on. And through Stan Fan, a few years later, it was in 1975, I think, I met David Marsden. David Marsden was an extraordinarily clever man, and he had exactly the same ideas as I had. The difference, he was more advanced in the clinical field. He was an excellent clinician. He was describing new disorders in the field of, we may come back on that, this is very important. But he was very interested in science, but science was perhaps a little bit weaker in London than it was in Paris at that time, at least in my lab. My lab, I have to say that in 1978, the lab was constituted by one person, that is myself. So, but after a few words, when someone called Etienne Hirsch, for instance, came in the lab, are you Etienne Hirsch? Yes, I'm afraid you are. I think so. Then the lab started to become a modest but good lab. And so we had a lot of connection, and we collaborate a lot. And I saw David Marsden very often. He was coming to Paris. We went to the restaurant La Coupole and had immense conversation lasting for hours and hours about the basic ganglia. He was learning, he was teaching me a lot. And we had something in common with David Marsden, that is some kind of fantasy and provocation. We were playing the fool quite often during each time. In the Congress, such as that one, we were playing together. We had a lot, because of this friendship and common interest in, perhaps in the field of philosophy, the philosophy of life and so on. So we had a lot of common. He was very influential for me. But I hope that we helped him a lot in the field, because of you, by the way, certainly, in the field of, with Peter Jenner, you remember, in the field of science, because you developed immunohistochemistry, autoradiography yourself, and this was used by him in his lab. So this was, I mean, that indeed in the field of movement disorder, Stan Farn as a clinician first, because we spent 1 year together in Paris, and David Marsden during the following years, because we had exactly the same type of ideas, were really influential for me.
With the years, your lab grew and it became a huge institute. You are probably the most cited French scientist. So could you just tell us in 2 or 3 words what are the achievements you are really proud about it?
3 words is a lot. I would say 1 word. We never made a discovery. We never made real discoveries.
I'm not really sure about that.
Not really discoveries. I think that the 2 main issues from our lab, but I am asking you the question, you may answer too. Besides really scientific words, are 2. First, the idea was not to get a Nobel Prize or something like that, but to develop a school of medicine. And the idea was really to teach medical students with this idea that good practice in order to take care of the patients depends upon a good teaching. And a good teaching cannot be performed without science, without research. And vice versa. If you want to do research in the field of nervous system, in the field of diseases of the nervous system, then you need the clinician. So this is a virtuous circle. So that's point number 1. Point number 2, I think we did in advance, although the term was not used. You remember when you came in the lab in 1980, if I remember well.
A little bit later, 84.
84. Then we did translational research before everyone, because I started by doing biochemical assays in the brain of patients, because it was not expensive. We could get the brain for less than €1. Although at that time I wanted to work on primates, but it was too expensive. I was alone, and so we started on post-mortem material of diseased patients, and but then we developed, thanks to you, cell biology and immunohistochemistry and so on, cellular imaging, molecular biology with Alexis Brice, and genetics. And then, of course, I was always involved in the field of clinical science, but with a different idea than before. That is, the idea was really to study pathophysiology. Because if you want to become a good movement disorder doctor, you need to understand the neural basis of these abnormal involuntary movement. You need to understand the biochemical basis of nerve cell death. Otherwise, you are just applying recipes. And so from molecular biology to clinical research and back and forth, this was the philosophy. Although perhaps we did not have that in mind really. The concept was there, but the formulation of the concept was not self-evident. But this was really translational research, wasn't it?
During all these years, you probably faced some major challenges, difficulties. How did you solve all that? Or
challenges in science, yes, and in politics too. The major challenge in science can be summarized as follows: complexity of the organization of the human brain. Complexity. So, for instance, you know much better than I do. For instance, if we come back to the problem of issues such as the nerve cell death, for instance, you have described with a lot of mechanism, integrated mechanism, translational signalization avenues and so on. But I am afraid that we are turning around this problem. For instance, we have not found any pharmacological target, exquisite enough to develop a medication in order to stop the disease. So this is the same is true for the neural basis of symptoms. For instance, what is bradykinesia? Bradykinesia, it's akinesia, it's slowness of movement, it's hypomotility, and many different components. It's very complicated. If you keep in mind that in 1 cubic millimeter of brain tissue you have thousands of neurons, each neurons with 10,000 or 100,000 contacts, and then it's like the universe. It's small, it's like the universe. So this complexity, I am afraid we didn't have that in mind when you came in the lab. You remember? We had vectors, anatomy was so simple. Now it's so complicated. So that in the field of science, this is still a challenge. And it's challenging all the more since the complexity is increasing. The more we describe, the more complex the brain seems to be. Politically speaking, also, we have had a lot of problems. The main problem for me was the difference between the past and the future. In the past, in the medical school, and even in science, everything was top-down. You had a boss, a chairman, a powerful man who decided. It was very difficult, and it's still difficult for the students, for the technicians to express themselves. And I hope that, I don't know, you will tell me, I hope that in the lab, people were free enough to do what they want, more or less. So there was a strategy, remember? We had several fields of research in order not to gather our ideas everywhere and to become inefficient. But in the same time, under the responsibility of the chief of the laboratory, everybody was able to do what they want, which was something bottom-up instead. And I think that creativity originates from a bottom-up philosophy. Do you agree with me?
I fully agree with you, yes. Where do you see the field moving in the next year? You talked about the complexity of the system. Is system biology the future of the field, or do you have any other major ideas about future strategy to understand movement disorders?
Doing in the field of movement disorders, yes. You see, science cannot be decided in advance. I mean, the major discoveries have been done in other fields. For instance, it may be someone working in the field of plants who might provide a new discovery, which might be applicable for Alzheimer's disease, for instance. You never know. The major discoveries have been done like this. In our field, I think the major challenge now would be to cure Parkinson's disease, to cure neurodegenerative disorders in general, ALS, Alzheimer, all these horrible disorders such as genetics disorders found in children and so on. If one was able to stop once one of these disorders, that would be a real step forward. Then if you have some idea how to cure one of these diseases, then it would be certainly possible to prevent the occurrence of the disease. But again, the complexity is so enormous that sometimes I feel less optimistic for the future, I am afraid to say. The same is true for repairing. Repair. For instance, someone who has lost the neurons somewhere in the brain in neurodegenerative disorders, or after a spinal cord trauma, the spinal cord is cut. How can you repair this? It is so complicated. The cellular organization is so complex that sometimes I must say when I wake up in the night, I am less optimistic than in the past. But I think this is a real challenge for the future, of course.
So what advice could you give to young scientists or young medical doctors to develop their career in this field? It's
well, it depends where you are. If you are born in the center of Africa, the problems, the questions are different from the one which are posed at the Salpêtrière Hospital or in Occidental developed countries. But in our countries, Occidental countries, I would say that the real challenge for a clinician, at least, and in particular for a neurologist, and in particular for a movement disorder doctor, would be to two things. One, not to be totally focalized in your field. I'm afraid someone to see that movement disorders don't do any medicine otherwise. I know, I'm aware of some movement disorders doctors who are purely specialized in Parkinson's disease. They see only patients with Parkinson's disease. I'm afraid that after a few years, you must become silly. So that one point, I think a good movement disorder should also be a good doctor with a good specialization. The other thing, which is the most important, I don't think you can be a good movement disorder doctor without knowing exactly how the brain does function, which means to spend sometimes in the laboratory and to be able to read the paper devoted to the pathophysiology of all these disorders, whether it's oriented towards neurophysiology and clinical practice, that is the neural basis of symptoms. Why do you lose the memory? Why do you have a tremor? Which are the brain structure, the brain's circuitry which is damaged in order to produce bradiphrenia, for instance. And the same is true for cell biology. That is, if you are really interested in prevention of these disorders, for neurodegenerative disorders, if you want to use new biomarkers in order to detect such diseases as early as possible during the course of the disease, then you need to be able to read papers and to collaborate with scientists involved in the field of genetics and cell biology. And I'm afraid that at this moment there is a real risk, because for many reasons that I'm not here to discuss this, of course, but less and less students, not only in our country but also in Europe, I've seen, and in the States, which is perhaps less so in China and India now. All these young clinicians are during their residency and even after their residency are doing retrospective studies, therapeutical trials, which is exactly, in my opinion, the contrary of science, the contrary of the spirit of science, that is to ask questions, new questions, creativity. Otherwise, the cooperation between real scientists who want to perform discoveries, to find new things, and clinicians who are there to take care of patients, this dialogue will disappear.
Mm-hmm.
And the main condition is to have medical doctors involved in science, like me, and to have scientists interested in the clinical field, like you.
So your point is that science should be interdisciplinary.
Yes, of course. Of course. And another point, you cannot do good science if you are alone in, somewhere lost in the middle of nowhere. So there is a need for the concentration of this type of profiles. This is why we are building at the Salpêtrière Hospital, by the way, a big institute of research in the field of neuroscience, where we have already recruited several hundreds, probably 600 researchers. So the concentration of basic science until the clinic and back and forth, with a clinical research center in the middle, with a biocluster, and in order to create an intellectual foyer. That's the aim of your aim and my aim at the Salpêtrière Hospital. I think there is a need of concentration in the way it is done at the MIT or Harvard or in some big universities of the States. They are good models, although they have problems too.
So if you could wind the clock back 20 years, what would you do differently from what you did? So would you like to develop such an institute earlier, or?
I don't think I would do exactly the same. I would prefer to avoid all the difficulties I had in order to set up all this. But I remember in 1973, when I became a chef de clinique, registrar, when I was responsible for a ward in our clinic, my chief nurse, who retired 2 years ago, gave a speech, and she said that in 1973, when I came there for the first time, I said all these services of neurology should be grouped in the same building, which we did, because now we have psychiatry, neurology, neurosurgery, rehabilitation in the same area altogether with one chairman and different units, which is a revolution in our country. And also I said that there we will build an institute of neuroscience. So this was almost 40 years ago. The idea was there. I'm not proud of that. I mean, it's self-evident, it's common sense. You cannot do research, alone with 1 or 2 students. Although I heard from my father, who spent some time in Krebs laboratory before the World War II, he told me that Krebs had a very small laboratory, the Krebs cycle, of course, and he had 2 students and 1 technician, that's all. So there are perhaps 2 ways of behaving in this field. But I think the concentration and to have an intellectual foyer like we do is a bet, but I hope we will succeed.
So you are really busy with this institute, with your clinical studies. How do you manage your personal life and your professional career? Would you give some advices to young clinicians?
Yes. Don't follow me. It's a terrible mess. It's a terrible mess because working too much, being selfish in one way, in one sense, doesn't mean that I didn't take care of my family. I've had several families, perhaps because of that. But on the other hand, so one needs to spare time for the family, of course, and for social life. What I did, but perhaps because I'm someone who is really atypical. Mm-hmm. I'm afraid I'm a little bit atypical, which is difficult to handle for a a woman, for instance, and for the children. But on the other hand, if you have no passion in order to build something new, then life in the family becomes dull. So you need this passion, and the only thing, the only quality I think I have is subconsciously is to be a very active person, and to I cannot stop working, doing medicine and science. There are only two things I can do. These are the two things I can do, nothing else.
It's a passion of your life.
If you can say so, yeah. But I am an old man now, so.
So we are at the Movement Disorders Society meeting. How do you see the influence of our society in the field? And if you have an advice, what would you say to the
You see, the Movement Disorder Society was really very influential, because it allowed to create an enormous dynamic for the future, because of these meetings, because there are clubs everywhere, and this is because of Stan Fun and David Marsden, although several of us, I don't want to give it, were there too at that time. And so there is a real dynamic of movement disorders in the field of science, because of few of us, and in the field of clinical, in particular semiology. This was the extraordinary idea of these two men, that is to use the video. We use the video, but they organize video meeting in order just for everybody to agree about the semiology. What do you call this? Someone say, what do you call this? No, it's dystonia. So we decided to have consensus meeting in order to agree to define what is a tremor, which is very simple. What is dystonia? What is a tic, and so on, so that everybody could communicate. Because in the past you were writing a letter, you say this is a dystonic patient, and someone understood something totally different from what you had in mind. And so that was a big success. Semiology on one hand, science on the other hand, that is the training of young medical students. So there is an enormous dynamic. This was really helpful, not only not for us, because we knew each other, but because this society was efficient enough, because we several students outside of Europe and the States have been trained, in particular in Japan, in Africa, in South America, in Middle East, in Russia, and so on. It took time for Russia and the countries from the East. But now it's the knowledge is common, the words and the language is common to everybody, so they can communicate, and there is some spirit that the movement disorders should be studied per se. There is a risk, nevertheless, and the risk that I see today is that because of this excellent journal, which is mostly clinically oriented, and because students are doing less and less research, then I see less and less papers, good papers, in big journals, so that the science is perhaps less efficient than in the past. I mean, I am talking about basic research. So if each of the specialty in medicine, already neurology, separated from other disciplines, but in the field of neurology, you have movement disorders specialists, with epilepsy specialists, with MS specialists. If they don't communicate, they should have a lot in common. The method in order to study the patient are in common. Science is common. Look, for instance, what you do in the field of inflammation, and you take a lot of information from the field of MS, for instance, I'm sure. So that's that's a real risk for the future. The movement disorder society is beautiful, is very efficient. One risk also is gerontocracy. You need to attract young people, to train them. There is a lot of effort which are made, but I think these efforts should be pursued and expanded. And but if the movement disorder society had not been there, then we would have had a lot of problems. We would have been gathered everywhere without connection whatsoever in the field. But for the future, the movement disorder society should be more and more involved in the field of science and in the field of pathophysiology in order to train the best students. Otherwise, the good neurologists will go and study other sub-disciplines of neurology.
So you really mentioned education of young neurologists, young neuroscientists. But during your career, did you experience some barrier or some major problems? And would you give advice to these young neurologists to avoid these barriers?
If you want to become a good practitioner, then you need to have a standard training to attend the best clinical department, really the best. But if you want to become someone involved in the university, that is to have responsibility at the university, then you need also to choose the best lab. One of the problems that the students know nothing about what is a good scientist. They know usually who is the best clinician, who is the best department of neurology, who is the guy who is good in movement disorder, right? But in the field of science, they don't know. And if you have a training in the field of neuroscience, then you need to go in the best lab, not just to do classical, conventional, descriptive, retrospective science, which is useless. So if I had an advice, I would say first to have a vision, to read the good authors, the best one, to come back to read Darwin and Claude Bernard, who are genius, and to see how these people worked at that time in order to get the spirit. And then if you have the spirit, then to go in the best department of neurology and the best department of science.
To conclude, you will give the David Marsden lecture at the 14th meeting of the Society. What will be the main message of your lecture?
Should I say it now? Yes.
Yes.
No. You see, David Marsden was a real master, a real conductor in the field of basal ganglia disorders, and in particular in the field of basal ganglia physiology. At that time, his message was that the basal ganglia were mainly involved in motor activity. He said the basal ganglia are there in order to automatically execute learned motor programs. I would add two things. One, the basal ganglia are not only involved in motor activity, in routines motor activity, but also in affects and cognition. They do the same. They do the three: motor activity, cognition, and affects, emotions, which are regulated, which are controlled at the level of the basal ganglia in order to become routines. What I do with my hands, with my lips when I'm talking, although my spirit is concentrated on what I say. At least I assume. The second message is to say a few words about philosophy. That is, to indicate that the basal ganglia are mostly involved in subconsciousness. Subconsciousness, a difference from pre-consciousness and consciousness, would be defined as I don't think that I think, I don't think that I do, that I feel, but nevertheless I think, I do, I feel automatically. And this is exactly what the basal ganglia are doing, I think. So in addition to David Marsden's statement, I would also add subconsciousness. The basal ganglia are involved in subconsciousness.
Thank you, Professor Agid, for your message to the members of the society and especially to our young members.
Thank you, Etienne.
Thank you.